think there are studies that are indicating that patients are happier with their surgical experience at a surgery center as compared to the hospital. This is an experience that we can tailor very much to them. They're not staying overnight. They're most comfortable getting home that same calendar day. This is something that the entire team is prepared and ready to do, and the whole surgical team is working towards that goal of getting the patient safely home that same day, and it allows us to be very efficient and give the patient a great experience. So the patient will come into the surgery center on the morning of surgery. They will most typically answer a bunch of questions through a standard post or pre-surgery checklist. The actual surgery time is 90 minutes to 2 hours, and then on average the patient is in recovery room for 2 to 3 hours after the surgery is completed. I will greet them, I will discuss everything with them. I typically mark the site of surgery, whether we're doing our right or a left knee. I will typically go through their post-surgical checklist in terms of their instructions for after surgery, and they'll be greeted by the anesthesia staff, who will also perform their peripheral nerve block in the holding area prior to moving back to the operating room.
I'm Reve Brander. We have a dedicated anesthesia team here that works with Dr. Hannon every week. And part of the experience that we offer to patients is, I think, a really personalized and dedicated experience. We use an opioid-free anesthetic plan for these procedures that utilizes regional anesthesia, along with some adjunct medications to make it as smooth as possible for everyone.
Well, the most difficult part of the patient's day, the day of surgery, is typically getting an IV line put in, because after that they do receive some medicine which relaxes them, and oftentimes they don't remember much after getting that IV line. They'll typically be wheeled back into surgery, and most typically the next thing they remember is waking up after surgery is completed in recovery room. The coach is often involved in dropping the patient off to surgery. We are in communication with the patient's coach shortly after the procedure, and then they will typically reunite with their coach after the surgery. And the nice thing about our techniques is they really have very minimal pain afterwards. So most patients, when they wake up from surgery, are essentially in no pain or very minimal pain because of the anesthesia techniques.